Hi, everyone. Thank you for the opportunity to be with you today, presenting at the CDC meeting, Virtual Connections. And thank you to NSBRC for the opportunity and the invitation to be a part of the presenters that are going to be sharing with you our experiences with prevention messages under the RPE program. Thank you very much. I'm Dr. Ward, Rebecca Ward. I am the director of Puerto Rico Rape Victim Support Center. We are a program of the Department of Health. And this year, it's our birthday. We are going to be 50 years old. So this is something that I wanted to share with you. From the Department of Health, I oversee and coordinate CDC-funded sexual violence prevention education initiatives implemented across the island. My work focused on the development, implementation, and evaluation of primary prevention and community education strategies aligned with the CDC technical package for sexual violence prevention and the social ecological model. Through cross-sector collaboration and culturally responsive messaging, our programs emphasize social norms change, bystander engagement, and sustainable evidence-based prevention across diverse community and institutional contexts. This is part of my team. This is us celebrating the SAM campaign, April as Sexual Violence Awareness and Prevention Month. To understand our outcomes, it is essential to understand our theoretical framework and foundation. At the program, our prevention efforts are grounded in the public health model and aligned with the CDC vision. This framework recognizes that sexual violence is not solely an individual level issue, but the result of interacting individual, relational, community, and societal factors. Accordingly, our prevention strategy emphasizes consistency and scope. Monthly campaigns tailored to specific audience and risk context, translating prevention from planning to sustained community action. This is our thematic calendar. And for our prevention messaging, we have selected a specific theme around sexual violence prevention for almost every month of the year, right? Every month has a specific theme around sexual violence prevention in Puerto Rico, and we have used that as a tool for mobilizing to the community and sending a specific message of prevention and call to action. We begin the year in January facing one of Puerto Rico's most complex prevention challenges, the San Sebastian street festivities. With attendance exceeding 1 million people, our primary objective is to ensure that individuals know where and how to seek help if sexual violence occurs. Our January campaign focused on increasing the visibility of the program helpline and our digital application. Our prevention team physically mobilizes to the event, distributing informational materials through high traffic areas. And these materials are not merely informational, they provide direct access to a 24/7 emergency service staffed by advocates trained in gender-based violence. By ensuring that the emergency number is in the hands of both tourists and local residents, we strengthen immediate access to support services during high-risk events. Prevention in this context means ensuring that amid the noise and crowds, pathways to help remain visible and accessible. In March, our theme is economic empowerment as a protective factor for gender violence. In this month, We commemorate the International Women's Day by focusing on financial literacy and economic empowerment, a critical risk factor according to the World Health Organization and the CDC. Among the strategies used by our program are the Women's Micro-Entrepreneur Fairs and distribution of technical assistance packages to community leaders. These are digital kits with ready-to-use tools, allowing communities to have access to organizations that provide trainings and seed financing to promote financial autonomy. In this way, we multiply the message that economic independence is prevention. April is our peak month. In alignment with the leadership of the National Sexual Violence Resource Center, we affirm that institutionalization of prevention efforts increases help-seeking behaviors. After 21 years of continuous prevention work and annual Sexual Assault Awareness and Prevention Month proclamations, the Puerto Rico Department of Health has been the leader and pioneer in the implementation of SAM campaigns across the island. Our most significant recent achievement was the enactment of SAM into law by the executive branch in 2024. This legislative action ensures stable funding and permanent visibility for sexual violence prevention initiatives, while also promoting shared responsibility among all executive branch agencies. So now it's not just the Department of Health that works for the proclamation at the Department of State, but every agency of the executive is mandated to work on sexual violence prevention during this month. From June through November, Puerto Rico experiences hurricane season. As documented globally, rates of gender-based violence tend to increase during natural disasters. At the start of each season, our prevention strategy focused on strengthening the capacity of first responders to prevent and respond to sexual violence. In June, we trained more than 300 professionals from the Department of Health, the Department of Housing, Family Services, and the Bureau of Emergency Management and Disasters Administration, agencies that are activated during emergency and disasters. These diagrams are the trees of action if sexual violence occurs in one of the shelters during an emergency and how to prevent these events from occurring. We conclude the annual prevention cycle in November by commemorating the International Day for the Eradication of Violence Against Women and the launch of the United Nations 16 Days of Activism campaign. This is marked by a public forum addressing emerging issues in sexual violence prevention. This was last year. In closing, the evidence is clear. Effective sexual violence prevention requires sustained, multi-level, and culturally responsive messaging. Research consistently demonstrates that prevention efforts are more effective when they extend beyond awareness raising and address social norms, bystander behavior, institutional practices, and structural risk factors across the lifespan. In Puerto Rico, year-round prevention campaigns enables message repetition, reinforcement, and adaptation to high-risk contexts, including festivals, natural disasters, and economic stressors. Preventing sexual violence is not a single campaign or event. It is an ongoing public health commitment grounded in science, equity, and collective responsibility. Thank you very much.